So I'm really sorry for the delay. I'm reason for the delay. So let me introduce myself first. I am Prof. Kosgallana. Most of you not have seen me. I am. You will see me more often of me when you come for your final years. So I am a professor in pediatrics, and I am the president of PeMSAA Medical School Alumni Association. PeMSAA. I'm sure when you pass out as doctors, you will join us. And what we do is we help the medical students during their undergraduate period. So we help with your academic work. We help you with when you come across certain unexpected situations in financially and otherwise. So whenever you find that things are not right for you, our office close to the dean's office, and we are always there to help. So now alumni are always there to help you, and we are ever always there to help you. So as part of the medical students in their academic activities, and we have been helping the final years and fourth year medical students in the past. So I must be thankful to Dr. Ruan, who has taken a great interest in helping the first year and second year medical. So you'll be now very soon will be facing your first main exam. So there'll be more and more exams to come over the next few years to come. So Ruan and along with Prof. Shirani and Dr. Indu and the group for the exams. So I'm sure it'll be a good eye-opener for you, and it will be for your life, for all your undergraduate career as well as for your whole life. So without much ado, and let me introduce, let me request and invite Dr. Ruan to take over and carry on with your discussion. Over to you,
Thank
Ruan.
you very much, sir. As sir mentioned, today there will be teachers from the preclinical departments joining us to tell you some things that you can, that we might be focusing on. We are focusing on the academic content, but still there are more things which. So I think to begin with, I can invite our two madams are here with us, Shirani madam and Indu madam. So Indu madam is currently connected with us. So can I invite Indu madam? You all know who she is, Dr. Indu Nanayakkara from the Physiology Department. She teaches to you. So to start today's discussion, she will make an introduction and tell us.
Thank you, Ruan. It's nice to meet all of you outside the lecture room. Can you, one of you, tell me whether I'm audible? Can you
yes,
hear me?
ma'am. We can hear you, ma'am.
Yeah. Thank you. Thanks. So just put a note in the chat box if there is any problem with hearing or seeing what. Right. Now, I think this is a good thing that the PeMSAA is doing, because whole of the first semester you learnt your academic work online, and it is now only that you will be doing a little bit of revision and also a little bit of practicals. So we haven't actually met face to face. So now in another 5 weeks or so, you will be doing your. I wonder why, Ruan, I'm unable to put my video on. I wonder whether it's better if they can see me.
Yes, madam, I think so. I think Mr. Vasanta from the TRC is here. I think he has to. Can you please allow us to share the video also?
Yeah, I don't have a video. I don't have a video run. I don't have a presentation. I'm just talking to them about some specifics. Okay, no, I'll continue while this I'm able to put the video on. Now to start with, I think you have already had the lectures. So in order to prepare for your exam, the first thing that you must remember in this exam, as opposed to the last exam you did, which is A-levels, is that this semester exam is not a competitive exam. How you do this right? So if you work in groups, sometimes stand certain concepts. Of course, because what you do at the exam, that is answering questions at the exam, is done alone. So you have to have clear concepts in your mind for you to write down. But since the knowledge has become so vast, it will test you for the facts you know. It is easier if you addition to your acquiring knowledge, it is also a big switch for some people to switch from your mother tongue to switch into learning in English, right? So it cannot be helped because Western medicine cannot be learned in any other language other than English. So you have to learn your English and be not only to learn but also to communicate. You have to be thorough with the English language. Right, so from today onwards, you have to somehow try to improve your reading. That is the skill of reading. That is to read the paragraph and understand what is said in a textbook. That is the reading skill. And then you have to improve your writing skills, how you put down things that comes to your mind on paper. Because we give marks for what you put down on paper, not for what you know. Right? We have no way of testing what you know other than to test what you can write on the paper. So you need to improve your reading skills, improve your writing skills. Of course, you have already brushed up on your listening skills because you have done a semester of lectures already. And then when you go up further in your medical student career, from about the second, third, fourth, and fifth years, you also need to improve your speaking skills. So even in the first year, you need your speaking skills. So you need to practice for these things. For example, some disciplines will have viva, PeMSAA examinations. That is, you will be asked to answer questions which are put to you verbally, right? You will go to a place and an examiner will question you verbally and you have to be able to communicate. So for that, to communicate something that you have learned, you should have that knowledge very clearly in your mind. And how you answer the question, listen to the question properly, and then focus on what you're going to say and start answering. Because in Vivas, a lot of people start talking and then only you start thinking about what you're going to talk, right? So when the question is asked, always repeat the question in your mind and then start answering, right? So for that, you have to be very quick with your thinking skills, right? So that will come in with practice. So in the first year, you will have very small components in your exams where you are expected to speak and answer. But as you go up and come to the final year, you will have a lot of talking to do in order to pass exams, right? So we are hoping that along this line, you will, along this time of 5 years, you will be improving your speaking skills. Now, there are lots of people who are going to talk to you. Today, I will talk mainly in relation to physiology learning. I would like to talk to you about how to write essay answers, because that's a thing that first years struggle a lot when they come to the medical faculty. It is partly because your writing skills, which you had developed up to your O levels, have been pruned out and demolished in your A levels, right? I'm sure in your mother tongue and also in English, you were very good in your writing skills when you did O levels. Most of you would have got 9 A's and 8 A's and so on, and you would have been star students in your own schools. But all that would have got sort of crushed because of the huge load that you had to learn in your A. And tuition classes, if you ask this, you write like this, and if this word is not there, you won't get marks. That is the sort of thing that the A level trains you for, right? Now, in the university, it's not going to be like that. In the university, when you write an essay answer, it has to be a proper essay. It has to have an introduction. It has to be organized properly. The main points first, and then the next important one, and the least important one last, right? For example, if I ask you, what is going on the Prematilake bridge? You won't say an ant or a worm, and cars and lorries. Those are the main things that go on the bridge. It is true there are other animals, cockroaches, ants walking on the Prematilake bridge, but we don't talk about it, right? So like that, when you're asked to write an answer, more important things first, less important things later. And then the answer should also have a conclusion. Now, I'm sure you have had a look at your past papers. Past papers are available in the library as well as in the, I think, in the form of a book in the your union bookshop. So you get hold of the past papers, look at what is being asked. So when you are studying for a section also, it is good practice to see what kind of questions are asked at the exam, so that you don't study all the necessary and unnecessary things, right? Look at the more important points and then study that further. And I'm sure all the lecturers would have told you that the lectures are skeleton of the topic. Make the lecture the skeleton and read that from a textbook. The recommended textbooks for each of the disciplines have been given to you at the beginning of the course. So try and read the main, if you might not have time to read everything, but at least read the more important things from the recommended textbooks. Because in the university, it is not like, you know, the teacher giving a note and you reading the note and then vomiting it out in the exam, right? And I have also noticed that in essay answering, there is another thing that you do, this common mistake that you all make, that is whatever the question that is asked, you look at the keywords and write what is in your mind or what you know, not the answer to the question. Right? So please don't make that mistake. If you're asked to compare two things, compare two things. Don't write everything that you have studied about what has been asked. Right? I am sure when we did online small group discussions and wrote answers, you have been told about these things by the people who corrected your answers. So I hope that is helpful. So remember those things when you're, because in MCQs and all, you're familiar with what you have to study, you memorize facts and then you do all right in MCQs. But in the essay writing or writing of SAQ answers is the problem you have. So I hope that was helpful. If you want to ask me anything, please, can you ask me now? Because I might want to leave a little early. Is that okay, Ruan?
Yes, madam.
Right, okay. So if you have, I don't think they are able to, I think the host has muted everyone and the other people cannot ask questions. So I wonder whether they want to ask anything, they can put it in the chat.
I think, madam, there's a connectivity issue that from time to time it's getting disturbed and the video is automatically turning itself off. But they can ask questions.
Yeah. So you can move on to the next one. If they want to ask me anything, they can put it in the chat and then I will answer later if you want to save time.
Sure, madam.
Okay. Thank you, Ruan. Thank you very much for organizing this. I think it's a very timely thing. Thank you.
And thank you to you, madam. As you said, you are having a very busy schedule these days, and tomorrow also I think you have a commitment early in the morning, right?
Yeah.
So with all that, so joining with us, especially to help these newcomers at the beginning of their career, although we say at the beginning now, they have gone beyond the first, they have gone beyond the first semester. So, so thank you, madam. Then
maybe if they have any problems, they can email me, Ruan. They can, yes, you can give my email when on what I have spoken later on.
Okay.
They can write to me.
Yes. If I get any questions, I will forward them to you.
Yeah. Okay. Thank you. Thank you. Then.
Okay. Then next, I would like to invite Shirani madam. She is here with us again. Professor Shirani Ranasinghe is not a stranger to you all. She has done many lectures to you in the first semester and this semester also. So to begin, to tell you about more things about studying and getting ready for the exam, I think Shirani madam will have some knowledge and insights to share with you. Madam?
Yeah, thank you, Ruan. Thank you for a nice introduction. So nice to meet you at least. So earlier we did lectures, so I didn't get an opportunity to talk to you, discuss your problem. But I think this is very leisurely we can discuss. Right. So Dr. Indu Nanayakkara, so she explained the general the situation that you are facing, the problems, everything. So I am not going to repeat this because not necessary to discuss the same facts, but I will directly come to our subject the biochemistry. So actually, maybe by now you may also have the impression that it is very difficult subject and many students fail, repeat, and boring. Okay, I assume these are the information that you have received from your seniors, so pass out medical graduates. So this is the general impression. But if you learn this subject properly, you will understand how important it is. Okay, so this is, don't think just to pass the examination. You can't learn or study the subject, the medicine. So biochemistry is the basis for whatever you are learning, maybe your pharmacology, um, pediatric, right, medicine, okay, even the management of surgical patient. So there are so many things. The basis comes from the subject biochemistry. Okay, so when we are teaching, so we always try to highlight these points. So you have to understand all these points that we are facing at this level. So you are facing, you will understand how important these points are. Okay, and don't concentrate on our notes only. Okay, so actually we don't have the practice of giving lot of notes. So our lecture notes, they are just the guideline, the areas that you have to study. Okay, so that gives you the area that we are expecting, like guidelines, as I mentioned. And so there are so many textbooks. Okay, so usually when we do a lecture, we at the end we give these are the books that you have to refer for that section, right? So unfortunately, you are, now you are in the faculty premises. So your library, our medical library is there, it's open. So you can go to the biochemistry, that shelves, and there are so many textbooks. Okay, so then you have to get familiar with the textbooks, because what I'm saying this is, when you read the textbooks only, okay, right? We give it, we deliver our lecture in point form, right? Because if I say, if you take a topic like regulation of blood glucose level, right? So it's a vast, broad area, the hormones, right? The dietary pattern, so everything is there. So that in a textbooks, so it will open up so many directions. The hormones acting on this, the background of the nutritional status, everything is there. The BMI of a person, okay? So how it is important. So these are, so actually the everything we can't teach within this 1 or 2 hours. So therefore, I am always telling you, so you have to read texts. Then only your the spellings, okay, the terms, medical terms, biochemical terms. So you will see this in the textbooks, and but when you keep on reading these books, actually you are in a position to face a Viva examination, Viva was it, right? And a seminar, okay, usually you have to you do some seminars also. So to do all these, actually reading textbooks, so you have to have that practice, okay? So don't think that you are learning biochemistry just to pass your Y1 S1 and Y1 the Y1 S2 Y2 S1, all these 3 exams, okay? Everything that you are learning, so it will be using in your future, right? So if you ask your seniors, they will tell you, when you go for clinicals, your consultant, they ask so many things, the basis of the clinical background regarding with respect to the subject biochemistry. And so if you come across any problem, so we are here to help you, right? So you can send us email, right? And so then usually we respond for the students when they ask certain things, questions. And hopefully when we are in the faculty premises, so whenever you see, when we are in the office, so you can ask whether we are engaged with some other activities. If not, so you are welcome to our office, and you can ask, discuss your problem. So I heard Dr. Indu, so she explained about the exam setup here, and you can go through the past papers and get an idea about the way that the questions are asked, but not like A-levels. So in the case of A-levels, so you can guess the areas comes the next year, right? Because there is a pattern. So please remember, there is no such accepted pattern in our exam, right? So the examiners, we appoint examiners in different manner, and they have the freedom of setting questions. So if you go through the past papers, you will understand there are no any questions get repeated for the SAQ, right? So therefore, the knowledge is the most important thing. So if you have a thorough knowledge, actually, I don't think that it is an issue of writing, answering the questions. So I think I don't want to take your time because there are so many other lecturers. I think Dr. Ruan will give you a nice introduction, and I think he's a nice, very, he's familiar with your than us. So you can ask questions, and if there are special things that I can answer, so I am ready to join, right? And I wish you a very successful seminar or discussion, right? One, you can take the mic.
Thank you very much, madam. So again, to Shirani madam also I have to thank, especially because like madam, you have also had many commitments today in Colombo, and just now you came, as you mentioned. So luckily you were able to make it in time. So
yeah,
I
today
think
with this heavy rain, there was a lot of traffic, and yeah, unexpected time was taken, I told you.
yeah. So it's a good thing for the students, madam, that they are getting these kind of opportunities,
Yeah.
and the staff is ready to take part whenever they are available.
Yeah,
So
actually, Yeah, they should have now understood if they are in the faculty, the way that we can interact with our biochemistry practical and tutorials, right? So they get the opportunity to ask. So with this pandemic, so we all actually miss you all, because we also want to see your faces and talk to you and get your feelings. So this is, but hopefully it will be all right soon.
Okay, man.
Okay, then.
Thank you.
Okay.
Okay. From this point onwards, I think we will move on with your specific questions. So, past couple of days, you communicated to us the questions that you have. So, today's discussion is an end product of your request, right? So, you have to understand if you are passive and if you don't come out with your problems, we cannot help you. But if you verbalize, if you forward your questions to us, we can help you even though the avenues available are limited, right? So today, to specifically answer your questions, Dr. Varuni Kosgallana from Anatomy Department is here with us, and myself, of course. So we will move on to the question discussion, right?
Excuse me, sir.
Yes, Mailaka.
So considering that this is our first exam, and we have about only 4 weeks left, I think a lot of students are facing the issue of coming up with a study plan aiming for the particular exam. So, is there any advice that you would have to give us?
Yes. So we will start with that. So how are we going to plan the coming weeks, right? Isn't that so? Right. Okay. So before going into that specific question, I want to emphasize one thing that Hindu Madam also mentioned specifically, right? So you have to always think that you are not studying for an exam, right? You are studying to acquire the knowledge and the skills necessary to become a good doctor. That is the idea, right? So always have that mindset. You are trying to learn the subject properly, right? If there's a skill, trying to achieve that. And when you do that, when you have the proper knowledge and skills, automatically you will pass the exam, right? So that is the mindset you have to have at the beginning, right? Okay. So we will move on to your question, right? So you are in the faculty starting from yesterday. You have 2 weeks more for your practicals and dissections, and then you have 2 weeks study leave. And we are hoping that you will be sitting for your first exam, which is the year 1 semester 1 exam after that. So you have 4 weeks remaining to plan whatever you're going to do, right? So depending on the individual, you might have different ways of approaching this, right? So I will share some ideas with you according to my experience, right? So first thing, now I believe now during the times that we had online discussions, online learning, you studied some content, you have tried to learn, you have tried to study some parts of the content of the year 1 semester 1. Some of you may have completed those activities, learning activities every day. Some of you might still have a certain amount of content to cover, right? So starting from today, how would you approach the remaining time? The best, there may be various approaches. What I want to discuss with you is that first you need to have the relevant documents with you, right? So there's not many, right? When I say relevant documents, I'm mentioning the objectives document and the detailed module documents, right? the one that contain all the lecture topics for the for a particular module, and it also contains the objectives for each lecture or a practical or a group discussion, right? So have that available with you, individuals. Each and every individual have it available with you in whatever the format convenient, right? In your phone, laptop, whichever, or in print out, whatever the way that is convenient to you, right? And the learning material, right? So maybe you would have had some problems downloading certain videos, lectures. So, but now that you are in the faculty, you can go to the e-library and you can download those, so you can share among yourselves, right? So don't wait until the last moment to collect these things. You have the objectives document and your lecture note. On one side you have the video, and if you have preparing notes, you can have your lecture notes, right? So first you need to have that, so that during the study leave you don't have to run everywhere looking for these things, right? So that is the first thing I want to tell you. Then starting from now, prepare a schedule for the remaining time period, right? So it might be a simple thing when I say that, right? So I will try to show you some way you can do this, right? A way that you can do this, where you can allocate the topics you want to study for the remaining weeks, right? So you can do like that, right? So this is a simple way, right? So some people will do it like this. And I'll try to show you something on the first column. Some people, this is the thing that we usually see, right? So in the first weeks, most of the students will try to continue slowly, right? So take topics and select some topics and you allocate certain time period per day to study. So this is just a rough thing I'm showing, right? And most of the students will say that they wait until the last 2 weeks, which 3 and 4. And they say, I will study 10 hours per day, 12 hours per day, or even more than that during the study leave. But right now I am going slow. So this is a negative attitude that I think you should come out of if any of you are going to approach the remaining time period like this, right? So don't think like that. You need to start working from today, and you need to try to finish most of the work before the study, right? So that should be the plan. So if you have a study plan like this, I don't recommend it. Right? So what I want you to do is try to finish as much as possible before the study, right? And when you start doing that, you need to focus on the core topics early, right? So when I say core topics, I want to mean there are certain topics you need to learn first so that you can learn the other topics. In every subject, there can be topics like that. In every module, there can be topics like that. So you need to, if you talk about nutrition, there are basic new topics on nutrition you have to study first, and then you have to go into specific topics. So when you are starting a study plan from today, try to finish the core topics first. If you don't finish the core topics and if you try to study other topics, you will find it difficult. So that is one thing. Then a very good student will be able to finish studying everything before the study leave so that you can do revision during the study leave. But many of us, we couldn't do that. Many of you also will not be able to do this. You will have some amount remaining for the study leave also. But try to finish as much as possible before the study leave. Don't have the attitude that I'm going to do everything in the during the study leave, right? And always have a buffer. When I say buffer, I mean anything can happen, right? So you plan to study for 1 week, but in the middle of that week, things can go wrong. Unplanned, unexpected things can happen. So you need to have a buffer also. So don't have a plan until the last moment. Don't have a plan until the Sunday before the exam, right? So I am thinking of something like this. So you need to have a better plan for the remaining, right? So here, of course, in the first column, I have not mentioned the number of hours you are going to work per day, because that can vary from person to person. Some people can work a certain number of hours, others cannot. So don't try to follow your friend. You have to stick your own pattern. But the important thing I mentioned to you is that try to handle the bulk as early as possible. Don't postpone things, right? So let's think that you still have some topics you need to read and refer, and you need to be thorough with, right? So focus on those things. Start with the core topics, and in the coming weeks, give more priority to whatever the new topics available that you have to study. So those are the things that I have put in green. So you can, in your own study plan, you can write the name, this topic, that topic, like that, right? So focus more on the remaining topics that you have not yet looked at, but also every day allocate some amount of time for revision and SAQ, right? The SAQ in the sense to try answering questions. It can even be other questions. Essays are also there, so like that. I have, for these instances, I have put SAQ, right? So I'll come to that later, right? And then when you come towards the latter part, and when you come towards the study leave, you have to allocate more time for revision. Don't wait, and you don't have to, what I want to say, it's not good if you still have so many topics remaining during the study leave also. You might have some topics, can't help. So if you have any, I have within brackets mentioned, so you can study them also, but more focus on revision, right? So there will be, after this week and the next week, on Friday, we will finish the practicals. So from Saturday onwards, you may take it as a study leave and focus more on revision. So this should be your plan. And of course, last couple of days, always have a buffer. So try to finish before the Sunday. Try to finish early. Because although you try to finish here, you will still have something remaining even on Wednesday or Thursday. So then you can leisurely finish those things off during the final remaining days, right? Okay, so I will mention a little bit about answering questions and revision also, right? So if it is possible, try to answer at least one question per day if you have not done until now, right? If you have done even before that, then you don't have to, like, you will have less work to do with regard to answering questions. But if you have not done at least one SAQ per day, try to answer, time it, and try to write an answer, right? Because otherwise, when you go to the exam, you will not have enough practice. And when it comes to revision, you need to have a plan on what topics to revision, right? For example, if you take the first week, what are the things you are going to revise? So you will be revising from the previous lectures that you have already studied well. So allocate some time every day to revise previous topics that you have already studied well. So Mondays, 1 or 2 topics, Tuesday, 1 or 2 topics, like that, right? At least one topic, right? Okay. And then not only that, so if you study a new topic here, you have to have some time to revise it towards the latter part of the study leave, right? So we are revising the ones that you have already done. At the same time, if you are studying a new topic right now, you have to have another session somewhere afterwards to revise that also, right? And then on top of that, there are some things you have to revise on the next day also, right? So when you study a certain topics, you will realize there are some small contents, small facts that you can revise every day without sitting down and doing the revision, right? So sometimes when you have to revise, you have to relax and sit down and do it. But on other situations, you can simply you can simply, while you are walking, while you are waiting for the lunch or any, if you have any 30 seconds available, you can revise certain things. So you have that type of knowledge facts also. So try to revise those every day. You don't have to schedule specific time periods for that, right? So I think when we come towards the latter part of our discussion, we will realize this more. I will come back to this, right? And of course, underneath I have mentioned one more thing. I have not indicated any discussions here because some people like to work individually. But if you like to do group work, considering even the COVID guidelines, if you are doing some, if 2 or 3 people are there in the room, you can discuss or allocate some time for discussions also, right? So if you try to plan with an understanding like this, you will have a better study plan, right? Okay. So I want to highlight the basis of this also. Of course, if you can remember the very first lecture I did to you, you can remember this. The basis of having a study plan like this is that if you do spaced revision, you will retain more, right? So I'm not going to go further into this, but understand that I'm telling you with the basis. So if you follow this, it's going to be more effective than haphazardly studying topics here and there, right? Okay. So I think I can, that's all I plan to tell you with regard to a study plan, right? Dr. Varuni, do you have anything to add?
So actually maybe they can find time to relax between this plan as well. Maybe they can allow time for that as well.
Yes. So I think you will be mentioning more about that
Yes,
in the coming
coming slides.
Yes, but it's important to mention here also, right? It's not working like continuously, but you have to have breaks in between also. We'll come to that also, right?
Yes.
Right. Okay. So, yes, shall we move on with the next question?
Thank you, sir. So it has come to our attention that there are different parts in questions, as in we have essay questions, we have SAQs, and we have MCQs, and if it's anatomy, we have essay questions and SAQs separately, and we need to know how to exactly navigate what we have in our syllabus to answer those questions. How do we study for different parts of the exam? That's a question we have.
Okay, yes, thank you. Right. So, yes, so we will move on to the next part, right? So you have different components in the exam, and how are we going to focus our efforts towards these different components, right? Right. So first thing, you need to know the format, right? This is communicated to you by each department at some point of the module, right? Maybe at the beginning, maybe towards the end. So the general structure of the exam for each module, right? For example, already you might know that anatomy, you have a viva, whereas the other 2 departments you will not have, right? So there are MCQs, SAQ papers, essay papers, OSPI, like that, you have an understanding, right? So be aware of the format first. What are the components, right? Not only that, so each component, how to face this, you have to have some sort of an idea, right? So for example, if you get an SAQ paper, let's say there are 4 questions in the SAQ paper. So you can write an answer to one question and then you can move to the next question. And suddenly if you remember something related to the first question, you can go back and write that also, right? So that ability is there when you are answering an SAQ paper. Same with MCQ, right? But if you are doing an OSPI, sometimes you have to write the answer within that 3 minutes and you don't get an opportunity to come back, right? So like that, you have to have a better understanding of exactly what you are supposed to do when you are facing each component, right? Next thing is just be thorough with the content. Yes, you have to focus on the exam components, but before that, just try to learn the content, right? Without, when you sit down to study, if you initially think about the exam, that will not be good, right? So just start with the content, and then you can try, as you study, you can try to maybe identify how certain things can be questioned, right? So let me quickly look at, yes, so there's no subject matter here. I'm just showing you some pictures. So just think about this part now. This is something related to COVID. So if there's something like this that you are learning, more common symptoms and less common symptoms, so you have to be able to tell me, okay, in which type of a question can we assess this? In which type of question will we be assessed, right? Can we ask this type of content in an MCQ? Can we ask this in an SAQ? Like that. So when you practice answering past paper questions, you will get an understanding about this, right? So a different thing, if you get an image like this, where can we get this image in the exam, right? Or something like this, right? So when you're studying, first focus on the content, but as you go on, try to think where they can appear in the exam, right? And after some time, I encourage you to create your own questions, right? So once you have studied a certain part, maybe you can create your own MCQ and you can ask your friends. So practice that. Initially, it will be difficult, but when you get the hang of it, when you are better at it, you will have a lot of a good understanding about the areas and what type of questions can be appearing from that area in the exam, right? So that is what I have to say with related to the second question. Yes, Dr. Varuni, do you have anything to add?
And not much to add, sir.
All right. Okay. So these questions, I think we can move forward, right? Yes. Do you have any more? Yes, I think you have more questions, right? So what is the next question?
So now, since we really haven't written SAQ and we haven't gotten an SAQ or essay marked by medical faculty staff before, sir, I think students would have a question of how a good answer should be, especially for an SAQ or an essay, and how they can write a good answer.
Yes. Okay. So I think Indu Madam answered this question. She gave you a lot of information, taking examples, right? So I don't think I have to go much into detail, isn't it? Right. But what you have is like you have a little bit of a fear. So am I writing this properly or not? So that is the doubt you are having in your mind, right? So when you are practicing, the first thing is practicing, right? So I showed you in the schedule, always allocate time to answer the SAQs and essays, right? And understand what type of questions can appear, right? So sometimes you might have to draw images. Sometimes you have to outline pathways. Sometimes you have to explain the basis. So those are some ways that SAQs can appear in the exam. So you have to be prepared for all these, right? So you have to be prepared and you have to reproduce that at the exam, right? So Indu Madam told you we can only test you by looking at the things that you have written. So don't hurry or don't rush and write everything that you know. You have to write a focused answer. So the first thing to writing a focused answer is to identify what is being asked. So if you have 15 minutes for an SAQ, it is okay to spend 1 minute to slowly read the question and get the idea into your head and organize the answer, right? Take even one maybe 1.5 minutes. So clearly get into your head what is being asked, what the question expects you to answer, and then quickly make an outline. I'm going to tell this first and then next this and this. So like Mindu Madam said, you have to prioritize the important things, not the small things, right? So you start with that and go towards the less important things and come out with the conclusion. So it is important for you to plan that in the beginning, right? And then write the focused answer. So if we take, so any topic, if we take a topic like jaundice, I can ask maybe 50 different questions from that, even 100 different questions based on the same topic, even from at your level, right? So I can ask from one side, I can ask from a different way, I can ask the basis, I can ask the outcome, like that, I can ask many things. So I'm expecting you to write the focused answer, right? That is a skill a doctor should have, right? And so try doing this, and it is okay to discuss your answer with friends. You are at same level, you are peers. Maybe most of time you might not be able to make like correct and guide yourselves by just discussing with yourselves. But if let's say 3 or 4 of you are discussing, if one person has written a totally different answer, then you have to discuss among yourselves and figure out who has approached the question in the correct way. So by doing that, if you are doing this every day, if you are doing this at least several times a week, then if you are not writing focused answers, you can figure out by yourself, just by discussing among yourselves, right? And then even today you heard now both madams offered to help in whichever way, if you can meet in person or you can send email. So when there are opportunities, you have to get the inputs from the staff. So that is why in your timetable, we have scheduled places for discussions, small group discussions. We conducted them online mode, but still the staff was there for you and you had the ability to read out your answer, maybe send your answer, and so that allow the staff to correct yourself, right? At least several people, right? Several people, if we break you into groups, so at least 2 or 3 people from each group, according to the situation, right? So what is expected from you is to take that opportunities and present your answers and see where you are making mistakes. So even during these 2 weeks, I'm encouraging you, try to find, there are different ways that the staff has allowed you to approach them. Use those opportunities and try to correct your mistakes. Because after these 2 weeks, when the study leave starts, you can't come to the departments for that purpose, right? You should know during the study leave, this area is out of bound for you. So you have whatever you are doing with related to this, you have to do it before that, right? And then practice. If you have more time, if you are feeling like you are comfortable, you can finish studying the content, then allocate more time for answering question. And with each time you practice, you will become better at answering the SAQ and essay question, right? Same for speech, same for even MCQs, right? Okay, yes. Right? Yes, I think we can stop the discussion on that question now. If Dr. Varuni, do you have anything to add? You can
Yes,
provide your input.
practicing is the thing. So when practicing, you should think about the time as well. So if you try to write too much on one part, you may not have enough time to write the other important parts. So you may miss the chance to get marks of those parts. So you have to think about the time as well.
So if you try to write your answer for the first time in the exam, you will fail in this time management, right? But if you practice before the exam, you will be able to write a good answer within that given time period. Okay. Shall we move on to the next question?
Thank you, sir. Another problem that we are facing is the fact that we get tired easily, especially when we're studying after dissections and everything. When we come to the hostel, we're easily exhausted after studying for maybe 1 or 2 hours. We can't study for a long time. And this is a problem that we seem to be facing, sir.
Yes, so I will be answering that question. So give me a minute. I wanted to turn on my video, but seems like I can't. First, I would like to thank Dr. Ruhan sir for making this event a success. You worked really hard and made a lot of effort for this. And thank you for involving me as well. Thank you for the PeMSAA for creating this opportunity. Okay, so Tisari, I will go to your question. Okay, so I hope you can see my screen. Can you see my screen?
Yes, ma'am.
About improving your efficiency, right? So you feel tired all the time. So you want to improve your efficiency, how much you work in a day, right? So first thing, you should take care of yourself, right? To become efficient, you should first take care of yourself. For that, you should have enough sleep, adequate sleep in effective manner. So you need about 6 to 7 hours of continuous sleep for that. And even if you have work like these days, if you have dissections, after you go to your hostels or homes, after taking a wash and having something to eat, you can have a small nap, right? So the effective time for naps is told to be 45 minutes. So a little nap will like rest. You will have a good rest and you will be able to study very effectively after that. So then about your meals, you should have balanced diet and meals at the correct time, right? So some of you tend to miss your meals, miss your breakfast. Like that, it is important to have your meals at the correct times. If you tend to have like your breakfast at 11 a.m. like that, it will disrupt your normal body functions, right? It will cause imbalances in your normal hormonal activities and it will cause you to become tired, right? And you should include all types of vitamins and basically you should have a balanced diet, right? So I hope you have good meals at your canteens and at the hostel, right? And then following a daily routine. So every day it's better if you follow a same routine, like go to sleep at the same time and wake up at the same time. Then your like body and mind will align with each other. So you will have a body will feel well rested and will get adapted to your routine, right? So if you study at the same time, it will be effective, right? And it is important to have breaks in between to refresh. So you can have a walk around your hostels like that. So like Facebook and YouTube, I shouldn't recommend, but you can use those to for a short time to get out of the routine studying and free your mind, right? You can connect with your friends, you can connect with your family, so you can use your breaks effectively like that. And relaxation techniques, which is basically meditation. So if you so meditation techniques, there are many books you can learn from YouTube videos. There are many ways to, you have enough resources to learn meditation techniques. So so meditating for a short time every day, it will improve your efficiency, right? So also you have to be nice to yourselves, right? So there's so much a person can do. There's a limit, right? So different people have different capacities. So one person might be able to study the whole day. Some people may be able to study the whole night, like stay until 1 or 2 a.m. But some people can't. So you shouldn't compare yourself to others and be nice to yourself, right? Understand what you can do and do your maximum. And then you can keep yourself motivated, right? When you motivate yourself to do something and you get, when you start seeing that the results of your motivation, when you, when you are discussing, you realize that you remember more, then you will start to appreciate more, and this will help you to study more, right? Then reach, so you have to remember that despite everything, if you can't get yourself to motivate, get yourself to do things effectively, you can't get up in the morning, you feel tired all the time, like that. So whatever you do, you don't feel motivated, it's time to reach out to others, right? You should reach out to your friends, tell them that you can't, you don't feel like doing anything. You should reach out to your friends, to family, and to us, right? To your teachers. We are there to help you. So if you reach a point that you think you can't handle on your own, you should reach out to others. Yeah, so this is the stress response curve. So in the y-axis is your performance, right? And in the x-axis, you can see your stress level. So the certain amount of stress is good for you, right? So up to a certain level, stress increases your performance. So you can see at this level, your performance is maximum, right? So when you get exams, you get motivated, you get a little bit of stress, and you get motivated to perform well. But if you reach a level of exhaustion, you pass this point, and if you cross that point, you should reach out for help and realize that it's not good for you and take a break, right?
If you are imagining yourself as a doctor in the future, that thought itself is a good motivation. For some people, you think about your family and I'm going to help my family, I'm going to help my villagers. That becomes a good motivation. For some people, simply the results is a motivation. So like Dr. Varni mentioned, like when you do something, you see that you can do something, you see the results, then that will motivate you further to work. So find where your motivation is and be okay with that healthy level of stress. Motivate yourself, take that challenge and work within that healthy level of stress so that you have your maximum level of performance, right? Okay.
Next question, please.
Yes, ma'am. Now, in our lectures, I think there is a lot of information that we can get from our lecture notes and the lectures itself, and especially the recommended textbooks. And I think a lot of students would have the question on how to differentiate between the needed information and the extra information that we can get.
Okay, so you are basically asking about the must-know knowledge, right? So first,
Yes, ma'am.
you have the lesson objectives, right? So these objectives are available at the Moodle for you to access. So these objectives give the basic idea, gives what you should know. So if you read these objectives and learn what they say, that is the basic knowledge you have to know. So, and then during lectures, you have to listen. So just reading the lecture note is not enough. So during the lecture, usually the lecturers say what is important, right? So they tell you what to concentrate on and how much you should know about the subject and the depth of it you should know about. And they also give you reference material. So Shirani madam and Indu madam both said that lectures are just a guide and you have to refer books. So in the lectures, usually the lecturers tell you what books to refer and what are the important things you should know about, right? So then you can have group discussions, right? So in discussions, when you talk about yourself, you can identify the important core knowledge. So you can divide topics among each other and discuss them. Then you will come to understand what are the important points. Then you can also use the examination questions from previous years. Like Shirani madam said, you can't use them to predict what comes in the next year or what comes for your exams. Those are not for predictions. You can get an idea what type of questions are being asked and like get the knowledge required for that, right? So that's what I had to say for that. Not much to add, much to say about this. Ruan sir, do you have anything to add?
Yes, I agree with you. Yes, Dr. Varni. And like when you listen to a lecture, I can take an example from biochemistry. Like I did lectures with regard to vitamins, right? So I told you there are some vitamin deficiencies are not found in humans, right? So when I say that, you have to realize that vitamin is not as important as other vitamins. And then I mentioned now this vitamin deficiency, as there are so many things can happen, this illness can occur, this illness. So then you realize it is an important one. So that is how you focus on important things, right? And then when you are reading a book, try to read on those important areas, right? Don't read the book from cover to cover. Even chapters, you don't have to read from one end to the other, right? For example, in the Harper's, I think at the very beginning, related to the topic of proteins, there are, I think, 3 or so chapters, right? And one chapter is mainly on determination of the structure. right? The various methods available to identify a structure of a protein, right? So that is totally outside your objective. So if you try to read that chapter from one end to the other, you are wasting time, right? So you have to prefer books and develop this skill also, right? And I want to emphasize again, in this course, you are going to become a professional. You have to develop the habit of reading books, everyone, right? Don't rely only on the lecture notes. Okay.
Okay, so can I have the next question?
Yes, madam. Another problem we have is the fact that in all the 4 modules, we have a lot of things that we need to memorize, a lot of things that we need to remember in order to answer the questions. And it's not just memorizing the logical concept. There are some facts that we need to by heart, and it's a bit difficult. Is there any way that we can remember better or memorize better?
Okay. So about organizing and remembering, right? So one thing you can do is try to see why you need to know these things, right? So, you know, I have given you my WhatsApp number and you can ask me questions, right? So actually one student from your batch, I was really impressed. She asked, I can't remember, the student asked me, why should we know all the pulse points in the human being and why not only the radial pulse? If we can know how to feel the radial pulse, wouldn't that be enough? Why do we have to know the pulse points of the lower limb, the posterior tibial pulse and dorsalis pedis pulse? Why should we know that? So questioning like that is very important. So you won't realize why you need to know something, right? So it's basically to identify narrowings and things like that. So I don't want to go into those details. I just want to show you that it is, if you realize why you need to know something, you will try to remember it better and you will realize why you have to remember these things. Next, you can find patterns. For example, in anatomical nomenclature, so the names of the muscles, they basically describe what they are. So, for example, extensor digitorum longus. So, extensor, it says that it's an extensor, right? It extends the extensor joint or something. So, digitorum means the digits, the fingers, right? So, it extends the fingers, and longus. So, it means that it's long, right? So, you can find those patterns, and in other things also you can try to find patterns. So I'm just telling an example. Then comparisons. So if I take a similar example, the upper limb and lower limb. So if you remember during one of our online practicals, the anthem practicals, Professor Ajit Sominanta with you compare the ankle joint and the wrist joint, right? So how they are similar, how they are different, and why is that? He used to compare. He compared these two to show you, right? So by these things you can remember, right? So instead of just listing down what the features of the wrist are, the bones, why they are like that. So if you compare it with something else, you can remember better. Then you can have multiple inputs. And with the technology these days, you have access to a lot of material. You can watch videos and read the books, listen to lectures. You can listen to the lectures online. They are available for you. Look at images, diagrams, tables like that. If you get multiple inputs, it will help you remember more, right? And if you can create tables or by yourself for the important things, if you try to classify them, you will be able to remember them more, right? So differentiate between facts and concepts. So as you asked in the questions, there are some facts you have to know. They are like directly you have to know, and concepts, they are for understanding. You can't memorize a concept, you have to understand it, right? So, but facts you may have to remember, but to remember that you can use the other techniques, right? So you can link new knowledge to the knowledge you already have. So build up on your what you already know. There are some techniques like SQ3R. So you may have learned this in schools as well. I will just mention what the letters say. If you are interested, you can learn more about these things through the internet, right? So S means survey, Q means question. The three R's are for read, recall, and review, right? So then having your own notes. It will really help if you have your own notes in your own words, created in a short manner for you to understand. And when revising, if you recall in the same order, it will help you to remember. Then you can use mnemonics, images, videos, and stories, right? So mnemonics, I remember in one of our sessions, I was going to tell you about the mnemonic for carpal bones, right? So I think you already knew about that and told me, right? So you already know this stuff, right? So mnemonics is a great help. There are lots of mnemonics. These two also you can find through the internet. Then there are images, videos. They are all freely available. But one thing, when you're getting stuff from the internet, you should be considerate of where you get these, right? So like KenHub for Anatomy is a good website. So I think we have already told you, Himari Madam may have told you about the good resources through the internet. So yeah, like Wikipedia is not a good site for you to learn things. Like if you already know about subject and you are able to read it with a critical mind, it might be okay, but if you are getting initial information, so then preparing effective short notes. So similarly, you can decide how you create your short notes, right? You know what, identify the important points and write them down in a way you can remember. Then you can revise these short notes and things. You can revise in your idle time, right? So while you are waiting for the bus, so in the canteen, if you are in the line for your lunch, during that time you have your smartphones, you can take a photo of your short note and revise it, right? Even in your mind, you can revise when you have free time, right? Then teaching someone is a really effective way, right? So you can teach your roommates or your friends what you have learned. You can divide the topics among yourselves and teach others, right? So if someone is struggling with something, you can help them by teaching them, right? So as in madam, I think said in the initial part, there is no competition among yourselves. You have to promote, help each other, right? You all are, you should help yourselves, all of yourselves, to become your best, right? Yes, so this is the mnemonic for carpal bones. And yeah, so I just included this picture. You don't have to know these details. It's just there are models. There are people who use these different types of methods to grab information. So some use visual by seeing things, images, graphs like that. Some people learn more by listening, some by reading and writing, some by doing kinesthetic. That means like dissections by doing. So it doesn't mean that you are separately. So if you learn by visual, you learn only by visual. So you can use all these techniques. If you combine all these, you will learn better, right? So if you read something and watch a video, and if you take practically, you practice it like in the sections, you will remember more, right? So this has been expanded. So this is basically for the next question, I think. So this also shows you the different methods of learning, right? So there are physical, like touching the kinesthetic part. As I said, the dissections for things like that. Verbal are the speech, words, writing, like that, communicating outwards. So then you have listening and visual, that are images. And then the logical learning, that is trying to figure out the concept, reasoning out, right? Then you have social learning, that is group studies. Then sometimes you need to have self-study as well, right? Okay, I hope I didn't confuse you. So, Ruan sir, do you have something to add?
Yes, I think the last part you explained so many things, Dr. Ward. That is because that is entirely a different area, like study methods, and that is a totally different thing. So on the verge of the exam, this is maybe not be the time to discuss a lot on that topic. But anyway, you discuss some of the things that like quickly they can use during this time, isn't it?
Yes.
Now, I will briefly tell you a couple of things before we conclude today's session. Now, one thing is, as you mentioned, it is important to study and recall in the same order, right? So remember now, if you think about your favorite songs or your sermons, your religious sermons, you always remember them, right? There's no basis, there's no logic to it, there are no visual things, there are no videos, it's just the words, but you remember, right? That is because you have been doing it repetitively in the same order. So this is how the brain functions. So studying also, prepare a note, when you prepare a note, follow the same order, right? That is one thing. Then you mentioned about SQ3R. So when you start beginning to study a topic, you need to link that topic to a already existing knowledge before starting, right? So let me give you an example. So in biochemistry, let's say you are learning about the HMP shunt, right? So you have to start sitting down today to study about. So before opening the pages, maybe you can think, okay, I know about glycolysis, I know about gluconeogenesis. Glycolysis is something like this, gluconeogenesis is something like this. So these are the purpose. So in this, there are say many chemical reaction pathways, and HMP shunt in among these other pathways, it has a particular role. It fits into this particular place. So you have to figure that out first. So then you have a place to store all the information that you are pouring into your brain, right? So first allocate that space in your brain. So that is what is known as linking with the already existing knowledge, right? Then about short notes. Can I show you one of the shortest notes that I have? Let me see. Yeah. So can you see this? So this is not one of my, actually I wrote this down today, but this is the type of short notes that I have been preparing when I was a student, right? Very early days, right? I don't have those notes. The thing what I'm going to show you here is that I have not written down the things to remember in my short notes. It is very small and I have only written the basic outline, right? And then what I do is I have about 50 or 60 very small notes like this in my pocket, right? Because we have the shirt pocket, so it's very easy. And whenever I have idle time, I can take out one and I can see whether I can remember what is written in there, right? So if I write down everything in this paper, I cannot check myself. What I'm doing is I'm checking myself. So I can do this in 1 minute. So those days when I'm going in third year, when I'm going for clinicals, usually I'm going I used to go in early morning. So the buses are not crowded. I get a seat and I make sure I'm safe, right? That is the first thing, right? I make sure I'm safe. If I'm safe, I can take out one note and I can try to record. So I can do maybe 15, 20 notes during the time period I am reaching the hospital. So that's what I mentioned to you, that you have to make use of the idle time, right? So there are so many idle times, even when you are brushing teeth, when you are ironing your clothes, if you have trained yourself, you can make use of it. So that is what I told you in the very beginning. When you make your study plan, there are some small content that you can revise every day, 10 times every day. So when you keep on doing like that, it goes into your system automatically, right? So that is the other thing I wanted to tell you. So you have to, what you have to do is you have to try out these things by yourself, right? And one more thing about this work and the visual, auditory, read, write, and the kinesthetic model of learning. So now don't try to study in detail and figure out which one is, isn't it, Dr. Warren? So it's about reflecting.
Yes, so it's basically, yeah.
Reflecting. So you sit down and when you think about it, you realize you are more comfortable with pictures or you are more comfortable with words. So figure that out and use more of that in your learning. So if you are more comfortable with images, try to remember more things as images. If you are more comfortable with words, try to remember more things as words. Right? So that is the concept of this model, isn't it?
Yes, and now actually they are promoting like not limiting yourself to one thing. You should, when learning something, you should try to involve all the 4 models.
Yes. And you will be more biased towards one or two, right?
Yes.
So that is how it works.
Someone actually inclined to one thing.
Yes. Okay. I think that brings us to the end of the planned questions, right? So do you think we have any sudden impromptu questions as well from the group? It's past 10 now, right? So maybe any burning questions, something that you didn't understand based on what we discussed? Anyone? So if not, I think as madams also mentioned, the opportunities are open for you to approach us. You have only 2 weeks, right? I'm telling you again, after this beginning of study leave, that is not the time before that. So tomorrow onwards, try to work your maximum and make use of these opportunities. And then by the time the exam starts, you all will be comfortable and will be able to perform at your maximum, right? Okay.
So I want to add something.
Yes.
One thing. So I want you all to understand that it is okay to allow yourself some time to adjust to a new environment. So allow yourself time. So with time you will. So it is okay to allow yourself some time, right? And if you fail to study to your expectations on Monday, so next day you forget about your failed experiment the earlier day and do your best on the second day onwards, like
Yes.
that. Yeah.
Yes. So every day is not equal, right? Some days you have ups and downs. So some days you will be low, but don't worry about it. But when you are performing at your maximum, then make use of that day to the maximum, right? So you work at a stretch for several hours and then don't stop. That is enough. You are at your peak at that day, work more and compensate for the previous day, right? That's how you do. Right. Okay. So once again, I need to thank, first of all, PeMSAA, Tusharu sir and President of PeMSAA and all the council and the members of PeMSAA for creating this type of opportunities. I need to thank Shirani Madam, Indu Madam and Dr. Varuni who joined with me today to have this discussion. Then the TRC, the Technical Resource Center of the Faculty of Medicine, Mr. Vasanthi is now at this late hour, he is coordinating this, even with the technical connectivity difficulties. And yes, and your students, everyone, two of you participated by asking questions, but they represented all of you, right? These are the questions representing all your concerns. And thank you for waiting during this late night hour, right? So we will wind up this discussion for tonight, right? Okay, have a good night.